Here you are watching drug-induced sleep endoscopy with BIS monitoring. The 38-year-old male with history of snoring, occasional choking. His body mass index is 23, so he's absolutely within range, not overweight. His nose and soft palate has been operated elsewhere and is doing fine. You can see the face septoplasty and turnoplasty already being performed. His apnea hypopnea index is 22, so again not very high. Uh, his concern is snoring sound and possibility of sleep apnea in future, which can you know affect his health. So as we go inside, you can see there are no adenoids. The salpingopharyngeal folds are grade 0. I'm at a BIS of around 80. I'm waiting for it to go below 80. There's a little bit of AP collapse on the soft palate. All right. So there is some postnasal drip as well, and there's a bit of anteroposterior collapse of the soft palate. He had uh, some epiglottic collapse before the first surgery, obviously, which was performed elsewhere, which has improved after the first surgery. And now you can see the base of the tongue completely collapsing. As the BIS is still in the 80s and late 70s, so is definitely not over sedated. And this is the high base tongue. Now the BIS is absolutely in the correct range, early 70s. And at this point of time, we see a base tongue collapse, which is both high and low. So obviously, he is not a fit candidate for a midline glossectomy because it's also the high base tongue which is collapsing and which is the main reason for his snoring now. It's also complemented by a little bit of uh, collapse of the soft palate, as you can see here. His facial profile, and that's the opening. His facial profile is normal, so is again not a great candidate for a maxillomandibular advancement. So he is a great candidate for a hypoglossal nerve stimulation, which will be minimally invasive. Now, before that, let's try to figure out if he'll do well with a jaw thrust. So mandibular advancement device. So we have gently pulled his mandible forward, very gently, and you see the whole airway has opened up beautifully. Can you release it a little? Yes. So with a little bit of, now can you lift it again? Very little. All right. So can you see this maneuver clearly says that even with a mandibular advancement device, both his palate and tongue Tongue is completely pulled forward. Palate obviously cannot be completely pulled forwards, but he'll still do quite better with a mandibular advancement device. The tongue part will be completely taken care of. For the palate, we might put a suspension bridge suture if at all. And you can see that tongue is not collapsing on the on the soft palate, right? So it's the soft palate collapsing independently. If you put a suspension bridge suture, he'll do very well on that part. Now, so still with a mandibular advancement device, his palate will not stop collapsing. Can you leave it now? Now we are leaving it. What I'll do now, I'll take him to one side. I'll rotate his head to the left now. Now let's see what happens when I rotate his head to the left. If he sleeps in the left position, what will happen? As you can see, when he sleeps in the left lateral position, the tongue base collapse still reduces to some extent, not as good as with the mandibular advancement device, and the palate obviously does not stop collapsing. All right, now we'll turn his head to the right. Can you turn his head to the right? Now we have turned his head to the right completely, and again the collapse is incomplete, but it is still happening both at the palate and the base tongue level. Now, can you do a jaw thrust in this position? So, a little bit of mandibular advancement in the right lateral position. Let's see how that works. That works pretty well. All right. So this is working pretty well. So he can be a good candidate for a mandibular advancement device first, and sleeping in the one of the lateral positions, so that his now you see his sleep apnea is completely gone. All right. So thank you for watching. So the treatment of choice for him is a mandibular advancement device. If that fails, then we can look at suspension bridge suture for the soft palate and hypoglossal nerve stimulation for the tongue. But that's not planned as of now. A mandibular advancement device will be a good thing to give him. And this also proves that only doing a nose surgery, howsoever good it is done, may not take care of the sleep apnea completely. Thank you very much.